Okay, before entering the patient's room, I went ahead and checked her chart history and made sure had the correct information. Go ahead and knock on the door. Hi, Mrs. Smith. My name's Kate. I'm from Respiratory. It sounds like you needed to have a little help with suctioning some of the stuff out so you can breathe easier. I'll go ahead and set up my suction canister on the wall and wash my hands. I'm going to put on some gloves, and then I'm going to assess my patient. I'll go ahead and check her SpO2, her respiratory rate, and listen to her breath sounds. Mrs. Smith, can you take some deep breaths for me? Okay. Can you go ahead and give me a cough? And I'm going to go ahead and hyperoxygenate my patient. So we're going to do some nasal suctioning, and that's a sterile procedure, Mrs. Smith. So I got to insert a nasal trumpet into your right nair there, and then we're going to go ahead and stick a tube down and help suction some of that stuff out so you can breathe a little easier, okay? All right. So it is a sterile procedure, so I would go ahead. I have already gotten my supplies. I have a sterile suctioning kit. And upon opening it, we'll see two gloves. You'll always have a clean hand and a sterile hand. My clean hand is going to be my left hand. I'll go ahead and put that glove on. And then my sterile hand is going to be my right hand. Okay. And now, I do have a nasal trumpet here. We're always going to make sure the bevel is facing the septum here, and I'm going to go ahead and insert. Go ahead and take a big deep breath in for me. 1, 2, 3, and done. We want to try to make it a nice smooth motion. It's really pretty uncomfortable for the patient, but we'll go ahead and put that in. With my clean left hand, I'm going to go ahead and put some saline into this sterile basin I have here, and with my sterile hand I'll go ahead and grab the suction catheter. I'm going to hook up the suction to the wall here, to the suction canister, and I'm going to go ahead and have my patient. Mrs. Smith, I'm going to go ahead and insert this, okay, here. Take a nice deep breath in and out, and one more in, and we want this to take less than 15 seconds. Upon inserting, you're going to feel a little resistance, pull back, and then you're going to go ahead and occlude the thumb hole and pull back on it. Okay, very good. Put it back into the sterile container here. I'll hyperoxygenate Mrs. Smith, assessing her vitals, making sure that her oxygen didn't drop too much when we did it. The suction needs to be set up to -120 to -150. And we'll go ahead and leave the nasal trumpet in because it looks like her oxygen dropped pretty good, and that was pretty rough on Mrs. Smith. So we'll come back a little bit later, Mrs. Smith. I want to leave this in so it doesn't cause any damage. When we have to get in and out quite a bit, it can really aggravate the tissue inside your nose here, okay, in your airway. So I will come back and check on you in a little bit. Are you comfortable? I would make sure the patient's bed is low, locked, they need anything. And then I will go ahead and take off.